My name is Jamie Feld, and I'm honored to serve as the new Deputy Director for the Opioid Response Unit at the Colorado Attorney General's Office, serving under Phil Weiser, Attorney General. How we tackle this, first I just want to say, we are at a critical juncture in addressing the opioid crisis here today. How we tackle this with the opioid settlement funds and the infrastructure we create will have an impact not only on the next 18 years, which is the duration of the opioid crisis, but for generations of Coloradans. My work in Colorado has taught me that we have to invest in local communities. And after years of waiting, we're finally at that date. Another round of applause. Getting close to that date. As you know, opioid settlement funds are currently estimated at more than $400 million over the course of 18 years. 80% is going directly to local and regional communities. While this is a once-in-a-generation opportunity, it's not sufficient to fully address the staggering crisis we're facing today, especially with fentanyl and the analogs we're seeing. For every dollar, we need to be particularly judicious and accountable for how the funds are used. I know I don't have to tell you all this. You are all sitting in this room as regional leaders, community members, and decision makers on how these settlement funds will be spent. I have no doubt you feel the same responsibility and weight for ensuring these funds are used for the greatest impact and need. So, with the majority of the funds going to local and regional level, we know it's critical that we support you as local decision makers with the right tools and resources. It's crucial we maximize the impact of your funds by complementing it with state, federal, and foundation resources. So let me tell you how we're going to accomplish this today, together in the next 2 days. We've captured the best and the brightest throughout all of Colorado, and I honestly feel that way. The speakers you see here over the next 2 days really are the best and the brightest that are donating their time to speak with you. And they're going to share some key information. We're also live streaming this event, so hello to everyone on Zoom, and we're going to have recordings afterwards. You'll hear from state and federal speakers about existing and forthcoming resources, so that you can be sure how to spend your limited dollars on what matters most for your local community. You'll also hear regional and local best practices. We want to start the conversation to hear what one another is doing. What is one region doing? What is another? What are the 2-year plans and how can they align? Or how can we duplicate, or not duplicate, but how can we make sure that they're integrated and working together? And you'll hear from people directly impacted by the crisis, such as people in recovery. We'll have an excellent panel on day 2. I really hope you stay for that. Our systems will continue to fail if we don't listen to those directly impacted. Our greatest intention is that you leave these 2 days feeling educated, empowered, prepared, and inspired to tackle the use of these funds in your communities. We know we're going to have to be strategic, data-centered, accountable, transparent, and a focus on the whole person. Not an easy undertaking, right? But I feel confident that everyone in this room has what it takes to make that happen. My interest in this work is both professional and personal. I've worked the last 9 years in Colorado, both at the local and state level, addressing the opioid crisis. See some familiar faces from my previous days. And this was before it was known as an opioid crisis. My big sister is in long-term recovery and is an enormous inspiration. She's listening online right now, so I have to do a good job. Unfortunately, through both avenues, I've known too many people lost to overdose. And I'm sure many of you have as well. We have a once-in-a-lifetime opportunity to make an impact on the lives of our loved ones, friends, and community impacted by the opioid crisis. Please join us in engaging in a lively discussion. Ask questions to our excellent speakers you'll hear today. Share on Twitter. Make note of what you learn and who to contact. We'll have a networking session on day 2. Please stay and make the most of it. It will require all of our full capacity to make a difference on this issue. Thank you. So to start us on a light note, while our speakers are coming up, I'll have them just come up right here and I'll introduce them in a moment. And we're gonna have Minty come up one more time. You'll get familiar with this name. So the first one is just a learning check-in. You're not expected to know the answer already, but just to see the baseline, what you feel right now and what are your gaps. And hopefully some of our speakers today will help address these. For those that can't see, it just says, I am familiar with accessing data for my region. I am familiar with allowable uses for opioid settlement. I am aware of best practices for opioid response. And I know who to reach out to if I have questions about any of the above. And the number for the code is 1354-9044. And we could put the Minty back on. Okay. Wow, so people are more familiar than I am giving you all credit. You all have been doing this work for a long time, so we see quite a bit of familiarity with data, allowability, about midway, aware of best practices, and knowing who to reach out to. But we would like it to really get to extremely familiar. So great to see that we're already at a good baseline. And by the end of the session, want to get you even further. So we'll give just one more minute, or not a whole minute. We'll do a little less than a minute. And I did just want to give a shout out to Karen McNeil-Mueller. She was supposed to be here today, but was exposed to COVID and had some symptoms. She's the president and CEO from the Colorado Health Foundation and is really a remarkable speaker. I really encourage you to take the time to listen to her talks in other settings because she speaks very eloquently to the point of diversity, equity, inclusion. And she wanted me to pass on her best wishes for everyone here. Great. So maybe it's decreasing a little bit, but we're still pretty good. And you guys know who to reach out to, so we're happy about that. So I'll move us on to introducing our next panelists. This panel, Setting the Stage, Colorado Data and National Practices, will help you gain a better baseline for the information. For any successful public health information, it's key to ground oneself in best practices. While the opioid crisis is relatively new, there's a growing mound of literature, and it begins to tell a very clear story of what works and what doesn't. In addition, for any public health intervention, it's key to gather local data to assess the burden and target groups at greatest risk. Today, we'll be hearing from two experts to help us better understand this. Our speakers are Kristen Pendergrass, Vice President, State Policy of Shatterproof, and Kylie Yocum, Drug Epidemiologist of Colorado Department of Public Health and Environment. Kristen works at Shatterproof, a national nonprofit dedicated to addressing the addiction crisis by transforming addiction treatment, ending addiction stigma, and educating and empowering communities. Kristen is well known at the national level for helping state and local governments incorporate evidence-based policymaking into practice and to respond to the opioid crisis, both now at Shatterproof and previously at her role at Pew Charitable Trust, often leading national lectures, one where I saw where she highlighted Colorado. So we want to keep it that way through all of your work. We lucked out that Kristen was here for the conference and was able to share her wisdom and research with us today. So I'll turn it over to our first speaker, Kristen Pendergrass. Thank you, Kristen.
Thank you, Jamie. All right, thanks everyone. As Jamie said, I'm Kristen Pendergrass. I work at Shatterproof. We are a national nonprofit dedicated to ending the addiction crisis through treatment, stigma reduction, and public education and engagement. In addition, we have a policy arm, of which I am a part, and one of the things that we really focus on is best practices in the use of opioid settlement funds. And Jamie's not lying, I talk about Colorado all the time, including this morning on a call with ONDCP. They said, oh, we're really worried that local governments don't know what to do with settlement funds. And I said, well, actually, I'm in Colorado. So I really do talk about you guys all the time and how wonderful and thoughtful you guys are being about this. So we're going to go through best practices in terms of process, but also there's a lot of resources out there that I want to make sure everyone here is aware of and able to access. So starting with the process, I'm just going to jump right in. Oops, did I miss one? Oh, no. So this is what I'm going to base a lot of my comments on. These are principles for the use of funds from the opioid litigation. They were created by Johns Hopkins University and a coalition, which I'll talk a little bit more about later, of about 60 different organizations that are nationwide, state-based, in all areas of the addiction crisis. So the website is down there at the bottom. I'm hoping these slides are going to be available for everyone. Yes, okay. So there's a lot of websites down at the bottom, and so you don't have to write them all down. But first, spend money to save lives. Next, use evidence to guide spending. As Jamie mentioned, my former role was in evidence-based programming, so I'm very insistent on the evidence piece. We can't forget about youth prevention. I'll talk a little bit more about that later. Focusing on racial equity. And then finally, developing a fair and transparent process. Okay, so for the process, best practices, as I mentioned, I often just point to Colorado for best practices, but there's kind of a wheel that I want people to think about. The first is in the approach and doing a needs assessment. Do you know what your community needs? Have you looked at that recently? Where are the gaps? To identify where the funding can be best spent. Finally, getting an advisory council, which Colorado did very well with the regional councils, and getting diverse input, not only from people with lived experience, but public health expertise, law enforcement expertise, getting all the right people in the room so that you have the right expertise to tell you how the funds could best be spent. Next is prioritizing. I'll talk a little bit more about this. This is both in terms of evidence, but also there's a lot of funding right now to address the addiction crisis from the federal government, from the state government, from foundations. So thinking really strategically about maximizing the use of all the funds. And I know we have a presentation later, right after this maybe, from Medicaid about maximizing Medicaid and making sure that you're using the opioid settlement funds on stuff that is not available from those other funding sources. And then finally, well, transparent reporting. I know the Attorney General's office here is working to get some really great dashboards set up, reporting mechanisms so that we can track how the money is being spent and have a transparent and a transparent process that lets people be held accountable and lets you all show all the great work you're doing. And then tracking outcomes. And this is something that at the national level we're really kind of struggling with, because what outcomes should we be tracking? How do we track those? What do we have the data to track them? So I'll talk a little bit later about some of the resources that are being developed to help states, local governments with all of these things. Okay, so at the national level, as I mentioned, there's about 60 different organizations that have signed on to the opioid principles. Shatterproof leads a monthly call for a coalition. There's about 30 different organizations that participate in that. Some of them are just really interested in how the funds are being spent, and I'd say a good 10 or 15 are actively engaged in either providing technical assistance, providing research, creating resources for states and localities in order to address, use your opioid settlements the best way possible and have the information you need. The one I'm going to highlight in a second is NACO, National Association of Counties. They're one of the few organizations that I know of that's doing this specifically for local governments. I know at Shatterproof, we track all 50 states, which is a lot. And so then when people say, oh, are you doing anything for local governments? Like, well, there's over 3,000 counties and cities, so it gets really overwhelming. So a lot of organizations are focusing on states. NACO is the one that I'm aware of that's really focusing on localities, but nationwide. All right, I'm gonna keep moving. So when we're thinking about how do we address the opioid crisis or the addiction crisis? These are kind of the 4 buckets that come up over and over and over. So prevention, harm reduction, which is sometimes called prevention because it's tertiary prevention, but usually we keep it separate. Evidence-based treatment, and then recovery supports. So there are best practices, and there's a lot of evidence available about all 4 of these buckets and what's the most effective. So quick little what the evidence is versus what's actually happening around the country. The Surgeon General's report, which is a little old now, I think it was from 2016, clearly shows that prevention is really important and that there are evidence-based programs out there for youth prevention. But unfortunately, over the past decade-ish, substance use prevention funding has fallen by 34%. I know from previous work that Colorado actually does a really good job at youth prevention through Communities That Care and other programs, but we can't forget that, right? I often say that the opioid crisis has been going on for 20 years, and if we had put more money into prevention when it started, who knows where we'd be. There's no telling, but we can't forget about it now. Another evidence base from the CDC, syringe service programs save lives. They lower the likelihood of deaths from overdose, they increase access to treatment, and they lower other communicable diseases. However, as I'm sure you guys have heard around the country, there's a number of communities that are shutting down their syringe service programs, not using best practices, and overall limiting access to them, when the evidence shows we should be expanding them. All right, and then finally, from the national academies, medications for opioid use disorder are the most effective treatment. There are 3 FDA-approved medications: methadone, Suboxone, and Vivitrol. I've always, in my previous roles, always advocated, and Shatterproof always advocates to have all of them available. Some work better for some people than others. We should have all of them available to anyone who wants to take this route to recovery. However, the truth is that in 2016, only 36% of substance use treatment facilities offered any form of medication treatment for opioid use disorder. So I said there's a lot of resources, and I wasn't lying. This is not exhaustive. These are just some of them. Brandeis, the Oregon Health and Sciences University, the Legal Action Center, Harvard, SAMHSA. I'm going to put a website up here that is like the go-to place for all the resources on what are evidence-based practices for addressing the addiction crisis, specifically opioid use disorder. This is created by our partners at Johns Hopkins University, who I believe are watching remotely. They have led a lot of this work and really been kind of the conduit between a lot of the organizations that are doing the work and the research that's out there. So highly recommend this website. There's a lot of good materials that they've created, one of which I'm going to show you in a second, but there's also just links to every other resource out there that we can find. So this is the one that I said I was going to show you, the primer on the spending funds from the opioid litigation. They go through all of the Exhibit E approved uses, which I'll talk about in a second, and talk about what are the evidence-based interventions for those buckets. And then the other one I wanted to highlight, because it's Colorado-based, is Blueprints for Healthy Youth Development. This is a compendium of all the different programs for youth prevention that are evidence-based, and it's a really great resource that I've used before, and it's just wonderful. So really good resource for prevention programming. Okay, in terms of metrics, which I talked about, right? Like, what are we actually going to, how are we going to measure whether or not we're doing well? I think the big picture is that there's all this funding coming in, and as we're seeing overdose deaths rise. So how can we measure our impact? A lot of what we talk about are overdose deaths, and that is of course a very important metric, but it's a lagging indicator. It takes a while to get that, but it also does not tell the whole story. A lot of states and local governments have been doing a lot of work over the past 20 years around opioid use disorder and substance use disorder. So are there other things that we could be measuring to show how we're doing. Are we making progress in the number of people who have access to medications for opioid use disorder? Are people coming out of carceral settings with naloxone? Things like that, kind of the smaller points that we could be measuring to track our progress. I'm actually going to go back real quick. So there are 3 main organizations, I'd add Hopkins onto this too, that have a working group that are creating some metrics, also aligned with the Exhibit E resources, and aligned with the core strategies to talk about some of those smaller level metrics that we can measure. In terms of financing, I mentioned maximizing the funds, prioritizing the funds. Bipartisan Policy Center has 3 really great briefs on federal funding for opioid use disorder and substance use disorder. I know they're creating more of those. And also the Pew Charitable Trust is creating some work and resources around best practices for financing principles, when to use Medicaid, when to use a SOAR grant, et cetera. And then I had a slide, but I think it got lost, about Exhibit E and the approved uses. Basically, I just wanted to say that big picture, Exhibit E, which everyone talks about, is from the MDL, the multi-district litigation. It has approved uses and core strategies. So the approved uses are like everything you can spend the money on. The core strategies are really the priorities they want you to focus on. And that translates in Colorado to Exhibit A, not to be confusing, which are the approved purposes for the spending of the opioid settlement funds. So I think we're going to hold questions, is that right? But one thing I forgot to mention for the principals, I have these little cards that Hopkins put together. So if you just come see me, I have a whole stack of them. Happy to hand them out. They have a little QR code that'll take you right there. And my email is just up there. It's in the slides. If you have questions, I'm happy to answer anything.
Great, thank you so much, Kristen. If there's one thing you learned from this, it's that you're not alone, that there are a lot of reports and best practices out there. Look at this website, you can see there's a lot of evidence out what you can use. Also, Kristen mentioned Exhibit E, that's at the national level, of course, just to make things difficult. We call it Exhibit A. I have some copies here, and I'm gonna talk about it a little bit throughout these sessions. Really recommend that you have it kind of a tattered cover by your bedside type of document where you look at this, see what is included as allowable uses. We really recommend that this is a good starting place, that not only in Colorado, but the national level, they're gonna be looking at this. So next I'm gonna be introducing our data drug epidemiologist here. I did put all the best practices in data in the morning. I'm an epidemiologist by training, so thank you for bearing with us, but this is all really important information. So we have Kylie here. Kylie Yocum is from the Colorado Department of Public Health and Environment. She has a knack for all things data and will be sharing some tips and tricks on how to access state and local data. I know that several regions are looking at maybe making a data dashboard for themselves or looking at how to start for a community assessment. We want to be sure that you know first what already exists. And we want this to be a starting point. We know that this isn't the be-all, end-all. We really need to be thoughtful about data. We didn't have time for another presenter, but he had a concept about how do we integrate all of our data systems? How do we make sure that they're all talking to one another? How do we make sure it's easy to access it at the local level? How do we make sure that this is a one-stop shop, not just for you as a policymaker, but the public? So we know we have a long way to go with data. This is just a starting point for you to see what currently exists so that when you're doing your own evaluation, you don't have to start at the ground level. So thank you so much. I'll be turning it over to Kylie now.
Good morning, everybody. It's good to see you all in person. I've seen a lot over Zoom. I've only been in this position virtually, so it's so wonderful to put those faces to virtual faces. Like Jamie said, I'll present on some Colorado data resources today. I'll start by discussing key trends we've seen in the last year related to opioid overdose before going into those data resources that everyone can access. And finally, I'll leave you with my contact information for technical assistance and collaboration. When we looked at key trends in opioid overdose in Colorado over the last year, we saw the stage of synthetic opioids really coming in, and the number and rate of overdose deaths that mentioned fentanyl continue to increase in Colorado. Of 1,258 opioid-involved overdoses in 2021, 912 of those death certificates mentioned fentanyl, almost 3/4. However, when we looked at the number and rate of overdose deaths related to prescription opioids that do not mention fentanyl, we saw that that rate remained low and stable. Looking at non-fatal drug overdose, we saw that the number and rate of emergency department visits related to that non-fatal synthetic opioid overdose are also continuing to increase. In 2021, we now have a national code for fentanyl overdose for fentanyl-specific analysis. And when we did that, we saw that 78% of synthetic opioid ED visits in 2021 were fentanyl-specific. And that was a lot of words, so here's the visualization. So that top blue line represents our total drug overdose deaths. Underneath it, it's the total opioids, any opioid analgesic, fentanyl, or heroin. That gray line that we see start to dramatically increase around 2018 represents fentanyl. And finally, that low and steady yellow line on the bottom is our prescription opioid analgesic in the absence of fentanyl. Now, as you're thinking about how to use data for your own jurisdictions, I wanted to create sort of an orientation for where to access these data resources. I've included hyperlinks throughout the presentation so you can just click and follow. No need to jot down URLs or anything. So the first is the CDPHE Drug Overdose Dashboard. I'm going to go into that in more detail in a moment, but that'll be our fatal overdose, non-fatal overdose, and prescription drug monitoring program data for all of Colorado. The Colorado Consortium for Prescription Drug Abuse Prevention has an opioid-specific dashboard that has treatment data, treatment admissions data, prescribing practices, and pain reliever misuse data. This open data portal is another CDPHE resource. It's for exploring more geospatial visualizations. Off the top of my head, a resource I've used from there before is a map layer of all of the buprenorphine providers in Colorado who are publicly listed on SAMHSA's website. Now, the State Epi Outcome Work Group has two resources that I wanted to highlight. They have what we sort of colloquially refer to as the dashboard of dashboards. That's our page of dashboards. They have compiled all of the state dashboards and even separated it out by substance. So you click on this link and you can just click on the opioid tab and you'll find your opioid-specific data. They also have great data publications. They have both data briefs and epi profiles, epidemiologic profiles. And they just updated these in 2021 to have some in-depth demographic information. And they also parse it out into specific substances, and they do have an opioid profile. And finally, we have our HealthWatch publications. These are housed under the Center for Health and Environmental Data here at CDPHE. Earlier this year, they published two data briefs. The first was a drug overdose decade in review, goes into the demographics affected that we're seeing, as well as some fentanyl-specific analysis. The second is a publication from the State Unintentional Drug Overdose Reporting System. This has context surrounding fatal drug overdose, including bystander presence and naloxone administration. And the data sources used in all of these above bullet points, as well as the key trend slide, are death certificates, hospitalization and ED billing data, the Prescription Drug Monitoring Program, treatment admissions for substance use disorder, and the National Survey on Drug Use and Health. I mentioned a lot of statewide resources, but a lot of these resources do have smaller geographic areas available for viewing and analyzing. And I just wanted to highlight three dashboards that I've seen locally that take this statewide data and bring it down to their level for their own programmatic purposes. And that's Pueblo County, Boulder County, and Tri-County Health Departments substance use dashboards, if you want to check to see how they've integrated the state data. I also included two national resources that, again, you can bring down to smaller geographic levels, not quite the county level, but certainly at the state level. So the first is the National Survey on Drug Use and Health. This has a variety of leading and lagging indicators depending on the data approach that your jurisdiction is looking to incorporate. They have outcome data such as substance use disorder diagnoses. They also have other outcome data such as justice involvement. They also have treatment data, including the type of treatment that was received and barriers to treatment. Additionally, they have some prevention components, including the perceived risk and availability of a wide variety of substances. Next is the Behavioral Risk Factor Surveillance System. Again, a nationwide survey that a team at CDPHE has analyzed the Colorado-specific results, and they're available to view in table format. BRFSS has a core survey related to health behaviors, health outcomes, and other indicators, but the state also has an option to add questions. Some state-added questions in Colorado in recent years have been questions related to injection drug use as well as substance use recovery. And the second bullet under that, the data biography, is a pretty new resource to me. I was recently on a call with some folks at Seattle King County. They have a team that developed data biographies for their national surveys and data sets that they use. And this is a really handy resource for first-time data users, especially for BRFSS, who need to who need to understand the methodology and ground themselves in the data. As promised, this is our Colorado drug overdose dashboard. We have 3 separate dashboards on this landing page: fatal overdose, non-fatal overdose, and prescribing data. So this is what you can expect to see when you land on the fatal overdose dashboard. As you can see, we have results by county, as well as you can select drug poisoning categories. It's probably way too tiny to see there, but for this example, I selected any opioid overdose, so you can parse it out by substance like that. There's a built-in interactability in the dashboard where you can click on a county you're interested in, and the demographic bar charts on the side will auto-populate to represent that county, as well as the timeline trend on the bottom. However, there's sort of a hidden functionality in this that I want to highlight. It's very similar. So for example, if I want to click on El Paso County, I can do that. However, if I also wanted to click on Teller County and see those 2 counties together as their opioid settlement region, I would just click on El Paso County, hold my control button, also click on Teller County, and that's going to populate those results for both of those counties together. So pretty handy resource for these opioid settlement regions as you want to get your personalized results. Additionally, this is helpful for our less populous counties because we have a suppression criteria. So if there's fewer than 3 deaths in a county, you wouldn't be able to see the data for that county. So combining these counties can help provide a fuller picture. And just for posterity, here's what the non-fatal dashboard looks like. Again, you can select any opioid and other substances. And finally, our prescription drug monitoring program. And this is a dashboard that's not related to the drug overdose dashboard. This is our Healthy Kids Colorado survey dashboard. They have data specific to the health statistics region map, and they also have different health topics. One of the health topics is prescription pain medicine. So you can see percentage of students who have taken prescription pain medicine without a doctor's prescription, either in the last 30 days or during their lifetime, as well as students who believe it is easy or sort of easy to get prescription drugs without a prescription, or those who think it's wrong or very wrong to use prescription drugs without a prescription. So this is another resource sort of targeting the youth prevention side that folks have used in their local dashboards before. And I know that was a lot of data all at once. That was sort of intended to be a crash course in orientation, so I would love to connect with you all to really make sure that the data is applicable for your jurisdiction and useful for your data needs. So please connect with me. My email is on the slide, and if I'm not the expert or the data user on your request, I'll make sure to connect you with the person who is. Thank you. Thanks
so much, Kylie. And let's put her contact information just on the screen. So you get a lot of emails, but we want you to know that, again, you're not in this alone. There are folks at the state that are willing to help you with your local data needs. Just that one tip and trick about you can get multiple counties at a time, great to know. You don't have to create that on your own. That's on the dashboard. Another tip is just that there's that dashboard of dashboards. So she didn't show the link of it, but there is a website on the SCOW, it's called, and there's just a page of all these different dashboards on it. We'll make sure you get those slides so you get that link. So next, we're going to go to questions. We have our great volunteer and staff member, Anna, here, who's going to be helping us get to you with your questions. So if you don't mind just raising your hand, she'll be able to walk over to you. We've got a little bit of time for questions. We've got one over here, Commissioner Lori Lasky. Thank you.
Just a quick question. We've been utilizing the dashboard. When is that updated? And the different time frames. In fact, I noticed the ER and the deaths there's quite a lag in there.
I'll give you this.
I know this one's working. That's a great question, and thank you for giving me the opportunity to make that update. So as it stands now, the non-fatal overdose dashboard has been updated with 2021 data. There is quite a data lag, as you mentioned, because we're waiting for our finalized results from the Colorado Hospital Association. So the non-fatal overdose dashboard is up to date with 2021. I'm currently working on our fatal drug overdose dashboard. That's my task this week. There was a little bit of change to the data structure that's just hindering that progress a little bit. So hopefully by the end of the month, we'll have the fatal dashboard updated. And our prescription drug monitoring program is additionally on a lag due to some of the legislative sessions and the capacity of our prescription drug epidemiologist. So that's also in the works. The fatal and non-fatal can be expected by the end of this month. Well, the non-fatal's already up, so thank you.
Hi, Liz Smith, Gunnison County Commissioner. Thank you so much for the resources that you presented. I think that some of them were new to me, and I'm sure that we will find them very helpful. The data question has been a very big motivator for our region. I think that it's really critical for just expeditious, allocation of resources, making sure that they're impactful. And in watching some other conversations unfold across the state from CDPHE, from Department of Education or Early Education, HICPUF, et cetera, and the emphasis on interoperability and the ability for these data dashboards to talk to one another, I wonder if there might be an opportunity for the state to develop an opt-in system so that especially some of our smaller regions that have more limited resources might be able to buy into something that is consolidated from the start. I realize we all have our own unique needs, but if there is an opportunity to consolidate some of this from the outset, I think that could be very valuable.
Yeah, and one comment on that before we go to our next question is that there are some folks out there that are talking about how do we do this. Dr. Barokas, who couldn't be on this panel today, he's looking at Massachusetts and how they have an integrated platform for various data sets, including the all-payers health claims, PDMP, drug data, criminal justice data. And so that is somewhere we could, as a state, look forward to as we get these settlement funds in. So this is really just a starting point. We will also have some presenters from the Behavioral Health Administration talking about some data that they are hoping to release about where are treatment providers. They're looking at, for their community investment grants, having a website where you could go to where there are all the treatment providers in your community. They launched one called, they'll say the name when they do it, but they have another one that's forthcoming. Great points, and I think we're looking forward to having a more robust data platform in the future. I see this question, and then over here.
Hi, Melissa Mouton. I run the Recovery High School here in Colorado. Question for Kristen. One of your 4 buckets was youth prevention, and with the work we do, it's really secondary prevention or early intervention. Can you talk about the intent of those national plans and whether they kind of are exclusively youth prevention or whether it's also what we do. Because I feel like we don't really fit in any bucket.
Yeah, it works, right? Working. That is a great point. I mentioned very briefly tertiary prevention, but I don't think people are talking enough about secondary prevention and the role that that plays. Most of what I've seen is focusing on youth prevention, which I'm sure many of you know, it's not substance specific, it's building resiliency, building life skills, it's community based, but I don't have a great answer for you, just that you bring up a very good point that it is probably lost in the conversation overall.
This is fabulous data. I love data. How do I drill down to a municipality? I find that most of this is here, assuming that we are all managing money for our regional councils, but not for the municipal data. So how do I get down to the details? Because there are very different cities within my county who have very different needs and things, so I want to be able to report out on what I'm spending the funds on.
Yeah, at this point with our data use agreements, at least for the buckets in our drug overdose dashboard, we're not able to drill down that granular at this point, but I absolutely understand the need and the vast variety of change in cities and demographics within a single county. So I'll keep that comment in mind, and I'll brainstorm, and, and that's the best I can do right now, unfortunately, with our current data structure.
Great point. Thank you for bringing that up.
Hi, Marcia Porter Norton, La Plata County Commissioner. We're in the southwest corner of the state. I'm curious for you, Kristen. We live in a geographically isolated region. We don't have a lot of the more intensive services that we need, which we're working on. What are the 3 to 4 things that we can do based on best practices in an area that has not the full continuum yet?
Put me on the spot. I think it's NACO that is specifically creating some resources for local communities in rural areas. I know that Pew has put together a brief on opioid use disorder in rural communities and what should be done. I think the pandemic gave us some innovations about how to address this in terms of telehealth, and then I realized broadband is an issue, and so it's not that easy, but I know that there is a bill in Congress right now to clarify the role of mobile methadone bans. So I think that there's just some innovations that are happening around the country in terms of mobile, using telehealth and technology. I know that workforce is a big problem. Who was I talking? Bipartisan Policy Center. Talked to them last week. They're really thinking about workforce and how do we address the kind of mid-level professional workforce needs that are, I mean, it's I think most acute in rural communities, but it's across the country. I know that's not like what can you do, but those are some of the things that people are grappling with across the country that I'm hearing that I think are most relevant for rural communities. And I would add transportation and housing, which no surprises there, but also I don't think we have great answers there either.
Yep. Time for one more question only. And if there's not one, we did have one online. So it's about, any last questions? We did have a question about, let me read it real quick. Do you know if other local jurisdictions are planning to use ODMAP? I don't see the rest of it, but do you see CDPHE using ODMAP? So ODMAP, you'll see it actually in our announcement slide, or actually later on day 2. This is a platform that's a collaboration with Rocky Mountain HIDA, and it is another tool that you can look at for real-time data to access overdoses. Do you want to speak to it at all, Kylie? I know you were at that recent summit.
Yeah, we are currently in conversations with jurisdictions about utilizing ODMAP for law enforcement and integrating that, sort of working through the early stages, the APIs and those things, but we are in discussions about it. So, great question.
Great, yeah. So stay tuned for day 2. So I think since we're done with questions, let's just go back to our slides. I did want to, again, bring up this Exhibit A. We're going to be talking about it throughout the 2 days, and particularly highlight a couple of the allowable uses that were discussed today. So some of them, instead of going line by line in this, after each presenter, we're just going to share what some of the allowable uses they mentioned. Some of the ones they mentioned today are regional planning to identify goals. So the fact that you can use your opioid settlement funds for regional planning, and then also that you can use it for a government dashboard to track key opioid-related indicators, as I know several of you are. Great. So we've got time for a little extra time.